People come limping into the office with pain in the back of their heel. There's only a few different tissues that really cross that. First we need to understand that the foot absorbs a lot of our body weight. We have the arch of the foot helping to spring load us to walk, but as we're standing there, that heel bone or calcaneus is going to absorb a lot of force. And depending on our mechanics when we walk or run, we can really overload it quickly. That yes, we can get fractures, but that's a really hard bone. You need some trauma for the most part to get that thing to break. So most times we have soft tissue injuries, and that could be where the calf becomes the Achilles to attach down onto the calcaneus. On the bottom side of the foot, we have the plantar fascia that's running along that arch of the foot that people get a lot of pain on the heel with. There's also a couple little nerve entrapments that cut across the heel that can produce that same pain and symptoms. And we see this more often with people who thought they had plantar fasciitis or thought they had Achilles tendonitis. They looked up some things online, tried it, and it didn't really help that much. Well, these little nerves help control not just muscles, but also where you feel pain and how you feel pain. So getting a little compression or entrapment on these nerves will produce a lot of irritation. It radiates that back of the heel and creates confusion. But in the office, when we go through our exam, we're trying to reproduce the pain. So if I'm poking through the Achilles and squeezing and it doesn't hurt, it's not likely to be the Achilles. Same thing with the plantar fascia. But when I slide along where the muscles and tendons cut through and around the calcaneus, or that nerve commonly gets entrapped, and that reproduces the pain, that tells us that, hey, this heel pain was more of a nerve entrapment, and when we treat it accordingly with things like heat, ice, stretching, especially calf stretching, foot mechanic exercises, foot strengthening exercises, but the soft tissue treatments of Graston, shockwave, and laser, we can really help get this thing back to getting you on your feet, getting the pain resolved, and getting rid of that pain in the heel that's keeping you from walking and doing the things you want to do.